Hey friends, welcome back to another episode of Going Nuclear. I'm here with a really special guest, James Scongack. He is the chair of the Canadian Nuclear Isotopes Council. And so we're going to be talking about a really, really cool topic, isotopes. James, welcome.
Thanks for having me.
Isotopes, why are they important? What impact are they making in our society?
Yeah, so I think the first thing I want to say is just how proud we should all be as Canadians about our isotope sector. So for over half a century, Canada has been a world leader in the production and the development and the use of medical isotopes all over the world. So if we think about global healthcare today, we would not have the global healthcare system we have, whether it's sterilization of medical equipment, whether it's the diagnosis or the treatment of cancer, if it wasn't for Canada's strong isotope history. So this is something that we are, very proud of as Canadians, and we have a broad sector across the country that really enables that. Looking ahead, one of the things that we all know is the unfortunate reality is 40% of us in our lives will get cancer, but 100% of us will be impacted, whether it's ourselves, our friends, our loved ones, our colleagues, people in our community. And oftentimes when on your podcast and in other forums, we talk a lot about energy in the context of electricity. So medical isotopes are really another form of energy. And it's a form of energy that Canada has a unique ability to produce in the form of isotopes that has an amazing impact on the world.
That's really powerful, like the impact that isotopes can make on cancer and, cancer diagnostics and cancer treatment. Tell us a little bit about the opportunities that are out there when it comes to nuclear and isotopes.
Well, I think if you look at Canada's nuclear fleet, our CANDU reactors in particular, between Bruce, Pickering, and Darlington, there's clearly also Point Lepreau. What's very unique about CANDU reactors is the fact that they have a unique ability to access a neutron source. It's 480 pressure vessels versus one, and also a certain flux in the reactor. Traditionally, reactors in Ontario and Canada have been used for the production of cobalt-60, both high specific activity and low specific activity cobalt-60. So that's used in sterilization, treatment of breast cancer and brain tumors. What we've really done now is change the game in Canada, where we're producing short-lived medical isotopes on a power reactor. In the case of Bruce Power, in partnership with the Saugeen Ojibwe Nation, with our partners at Isogen, which is Kinetrix and Framatome, and ITM, we're producing lutetium for certain types of neuroendocrine tumors and prostate cancer. At Ontario Power Generation, a major success with the production of molybdenum-99. So what you really do is seeing the ability to use power reactors to produce medical isotopes. Why that's so important is because we have multiple reactors that provide that redundancy. And to have the redundancy is what provides the reliability. So not only are we producing medical isotopes, what we're doing is we're inserting into the global market that resiliency, that redundancy, so people can count on that supply.
These isotopes are like a vital lifeline for so many people across the world.
Absolutely.
Tell us a little bit about the market share for Canada when it comes to isotopes.
So if we look, absolutely, it's a great question. So if we first let's think about the global demand for isotopes. So we are very blessed here in Canada to have access to great healthcare. Can always be improved, but if I look back a number of months ago, we celebrated our 73rd anniversary as Canadians of the first cobalt beam therapy in London, Ontario. In fact, when that happened, it was such a great Canadian success story, we made a stamp. And today in Ontario, you look across the University Health Network, you look at Sunnybrook, you look at Princess Margaret, hospitals all over Ontario and Canada providing really good diagnostic treatments and therapeutic treatments using isotopes. But if we now take a step back and think of the rest of the world, in countries in Africa, poorer countries around the world, you will find hundreds and hundreds of millions of people today in the world that do not have access to that treatment that we had 73 years ago in Canada. So it's a reminder for us all that as global population increases, but most importantly, as people who do not have access to the same kind of healthcare that we have here in Canada, we want them to, over time, hopefully sooner rather than later, have access to more of that. that will require a higher volume of medical isotopes. So just looking at pure population and more people wanting access to modern healthcare, that in itself is going to increase isotope demand. That's before we take into account the fact that there are so many new uses for isotopes. In the case of lutetium, as an example, there's 200 clinical trials underway into how that isotope can be used. And so this is a growing space. In terms of Canada's role today, we are a world leader in almost every market category. So whether that's the production of cobalt-60, you see that at Pickering and you see that at Bruce, whether it's the production of lutetium, whether it's the production of libidium-99, you look at our research reactor at McMaster University, heavy in the iodines. So Ontario right now is a dominant player. But I think what's also more important is to really recognize this is also part of energy security as well. We do not want to rely on countries that will use isotopes as a geopolitical weapon. We know, for example, right now, Russia is a major world supplier of isotopes, and that's fine. But we want to be a reliable Canadian source of isotopes, and we're not going to let geopolitics get in the way of the critical isotopes people need for good healthcare, cancer diagnosis, or cancer treatment.
I know medical isotopes are produced like in a mass, in a large volume through power reactors, as opposed to research reactors, which are producing a lot less isotopes. Does this affect the cost of isotopes across the world?
Well, if you look at what a research reactor from a neutron source perspective, I think of a research reactor as like you're lighting a match. When I think of a large CANDU power reactor, I think of it as the sun, right? So you have a much larger neutron source, understandably. The capability of us in power reactors to produce isotopes, we could very easily supply 500% effectively of the world. So we have a capability that is really unlimited. What the power reactors are really, because the research reactors like McMaster, they produce it reliably and at a low cost. They're very effective at what they do. What the power reactors provide is that reliability. Because if we have isotope delivery systems on multiple reactors, when a reactor is off on refurbishment or maintenance, there's another unit that can build it up. There's also a volume that a research reactor just can't compete with, nor does it need to compete with. So we very much look at our power reactors as very complementary with research reactors. But to your point, we have a capacity that is unmatched around the world. And with that comes a responsibility as Canadians to look at what can we do to further that and really provide the world. The Canadian Nuclear Isotope Council has an initiative called Isotopes for Hope. And one of the key elements of Isotopes for Hope is doubling Canada's production by 2030. And we're well on track to doing that.
Tell us a little bit about the Isotope Council. What's the objective? Why was it founded? And tell us a little bit about the membership as well.
Yeah, so the Canadian Nuclear Isotope Council, I very much look at it as it's got a startup mentality. We have an amazing team that leads the Isotope Council. We have over 100 members. It was founded in 2018, and really what it was a recognition that we as an isotope sector in Canada were not united. One of the things that we as Canadians often don't do is sometimes we don't talk about our successes as a country as much as we should. And so the Canadian Nuclear Isotope Council was really born out of how do we come together and tell this success story, firstly in an integrated way? How do we come together and as a sector to put a bold vision in terms of the future? And how do we capture the moment around that growth in supply I talked about internationally, but also the growth of the nuclear industry here in Canada, what that could mean? The focus here in Canada around energy security, but also the goals in Canada from a health perspective. And so the council has grown. It's very diverse. We've talked a lot about reactors today, but it also includes cyclotrons, which play an absolutely critical role. It covers clearly research reactors, but pharmaceutical companies, universities, we're a very broad membership. But it's really that Team Canada approach to isotopes.
What is your vision for this organization?
I mean, fundamentally, the way I sort of look at it is we have a responsibility as Canadians to provide leadership in this space. There are people all over the world that are impacted like our families are, like our friends are with cancer. There are people all over the world that need access to modern healthcare like we have here in Canada. So the Canadian Nuclear Isotope Council's vision is to continue to assert that leadership role that Canada has. In the short term, it's about by 2030 doubling our production so we can meet that demand. But most importantly, it's about embedding this in Canada from a public policy perspective. There's a lot of discussion on tariffs and trade and energy security. Isotopes, I believe, are an important part of energy security and energy independence. And so it's a great way to build what I hope will be a positive relationship with the United States, who use a lot of Canadian isotopes, by the way. And we do a lot of they do a lot of processing. And so there's that bilateral relationship. But fundamentally, it's about the world is counting on Canada, and we are always best when we're united. And I think it's a very aspirational and just, great story that we can all be proud of.
Absolutely. Tell me about supply chain challenges when it comes to isotopes. I know right now the world's in a really unique spot because there's a next nuclear renaissance.
Right.
We're on the brink of a next nuclear renaissance. And so this might mean more CANDU reactors. It might mean more reactors across the world that have that hybrid functionality of like producing isotopes and electricity. How will global supply chain of isotopes evolve with these new technologies?
Well, I think the most important, if you are, I always say our job is to make sure that an oncologist, a nurse, a frontline healthcare professional never has to worry about reliability. That's our goal. And so to me, that's what secure supply chains are all about. How do you work from that endpoint back? And so that starts firstly with the supply. And that's what we have existing in Canada. And our existing fleet can more than provide for the global demand. If you look at the life extension of Darlington, the life extension of Bruce, the potential life extension of Pickering B, those units are going to operate into the 2060s, 2070s, and 2080s. So number one, we have that foundation of the supply and the redundancy of it, and that's most important. All of the supply chain that we primarily need is located here in Canada. So scaling that is not a challenge. It's something we have tremendous expertise in. But what I would also say is Canada has the partnerships around the world that are important to this. Partnerships like ITM in Europe. You look at BWXT Medical, which has a presence in both Canada and the US. I mean, the list goes on. And so I would say that this is a very stable supply chain, and it's made in Canada. So we are not prone in the isotope space to geopolitical risks, to economic disputes, if I want to call it that, economic challenges. And so that's another strong story here. When we had the pandemic, we did not have an interruption in isotope supply. Why? Because we had that made in Canada nuclear supply chain that was able to support production of isotopes.
This episode is being recorded live at the annual CNIC Conference, Canada's largest gathering of professionals from across the nuclear industry. If you want to know more about the association's work, please click on the link in the description below.
Honestly, I think it's really timely that that we're talking about this, right? Just because of global uncertainty, right? Global uncertainty is always there, but at the same time, the supply is always required, right? Like people
Absolutely.
across the world always need that vital lifeline of isotopes. So it's great that you're talking about that resilience. I want to explore the topic of cyclotrons.
Sure.
Okay, I don't come from a cyclotron background because I know it's not necessarily very nuclear reactor heavy.
Yeah.
Tell us a little bit about a few organizations that
absolutely
are part of CNIC.
Yeah, and because I work for a company that operates reactors, tend to get most questions on that. But what I would say is Canada equally has a very impressive cyclotron community. If you think of Triumph out of British Columbia, it's the world's largest cyclotron. And so if you think of all the isotopes we need, the isotopes you can make in a power reactor, neutron-heavy isotopes, you can't make in a cyclotron. The isotopes you can make in a cyclotron, you can't make in a reactor. So we need both. And if you look across Canada, and Triumph is the best example, but we have, cyclotrons in most Canadian provinces. And what those cyclotrons are doing is, again, producing those isotopes used for diagnostics and therapeutics. And oftentimes they're cyclotrons closely located to university hospitals. So the isotope is produced and easily transported. But Canada is a world leader in that space. If you, for example, look at at Triumph, they are leading the world in actinium-225. Similar to lutetium, I call it a heat-seeking missile isotope. So that's what's also unique about Canada. We're not just reactor-based, we also have that cyclotron base. And that's really important because similar to when you talk about electricity supply mix, you want a diversity of supply. We want to be able to produce every type of isotope in Canada and ensure that we're providing the isotope and the product that frankly is best for patients. And if you need a reactor for that, we have a reactor. If you need to test it, we have a research reactor for it. And if it's a cyclotron-based isotope, we have that too. Before the Canadian Nuclear Isotope was formed, you asked about the history earlier, there was this perception that reactor-based isotopes were competing with cyclotrons, and we needed either reactors or cyclotrons. The truth is you need both. And I think that's where you ask about what is the Canadian Nuclear Isotope trying to achieve is that unity. Because as you know better than anybody, because you do a lot of just fantastic education on energy and nuclear, it's very important that we give a united position to our policymakers. And that's really what CNIC has sought to provide.
Okay, that's really cool. It's great that you bring the industries together on one platform. What are some of your future initiatives look like with this council?
So, as I mentioned, we're a council that's been formed since 2018. We have a fantastic staff. We have a fantastic board. We have over 100 members. Really what I see is continuing to advance the Isotope for Hope campaign. So the first thing is continuing to double down and see that production of medical isotope, doubling of production by 2030. We have to stay on track. If you look at the projects that are in the pipeline, we are on track to achieve that. And that supply security is so important. So number one, I think that's a critical component. I think it's really important for us to continue to embed this strategic advantage that Canada has in our provincial energy policies across the country. You see real leadership in Ontario as an example there, and at the national level, and that is really important. I also think if you look at a recent memorandum of understanding that we've signed with the International Atomic Energy Agency, an organization that you're well aware of, we are very supportive of their Raise for Hope campaign, which is focused on ensuring people in poorer countries have access to some of the treatments that we talked about. And so we have signed that collaboration agreement. And, we're at a time in the world where a lot of people just want to look inward at their own country. And that's, we have to build Canada. We have to do that. But I think the Canadian Nuclear Isotope Council has an important role to play in making sure we do everything we can as Canadians so everybody around the world has access to the best health care. And that's not going to happen overnight, but that's going to be a significant priority. I think the other area that I'm personally quite passionate about is I believe the production of medical isotopes in Canada can be a real tool for reconciliation. At Bruce Power, the organization I'm a part of, we have a partnership with the Saugeen Ojibwe Nation. They are owners in our isotope program. And if I think about where a lot of our isotope infrastructure is currently exist or could expand in Canada in the future, many of those locations are on traditional territories of First Nations people. And what better way to advance reconciliation through reconciliation, getting in First Nations participation and investment in this? Because fighting cancer and building a healthcare system for around the world, that's something we can all agree on. And, we're very proud, for example, the leadership of the Saugeen Ojibwe Nation in that. And I think that's something that can be built on. It's
great to know that there's that reconciliation factor and you're working with those Indigenous communities. It seems like a great opportunity for them. Let's talk about the global impact of isotopes. And, you mentioned how internationally a lot of countries across the world simply don't have access,
right?
Accessibility, just because of, there might be issues with costs. Sometimes there's certain isotopes that need to be reached on time.
Correct.
And there's kind of that supply chain issues. How can we create a future where everyone has access to isotopes for healing?
Yeah, I think that should be the vision. It's really sad to think in some of these countries that there are people that are dying and they don't even know they're dying of cancer. And we know from our experience here in Canada that, the most devastating news you can receive or a family member can receive is they have cancer. But there is also hope that, okay, there's tools to detect that, there's tools to treat it. In a lot of these countries around the world, that is just not the case. So, I mean, to me, I think what we really want to do is this is really about, having that view of what can we do to help? What can we do as Canadians to, and I think firstly, making available the supply at a scale and reliability is important, because if the supply is there, that does keep the price point more manageable. It's still, far too expensive. And I think really working with the International Atomic Energy Agency, the Director General, the vision of this, I think is so important. There's things that we take for granted in Canada because we've been managing these kind of materials for 50, 60, 70 years. So also sharing that experience with healthcare professionals who have never worked with radiopharmaceuticals. I talked about that example of that cobalt treatment 73 years ago as an example. There's a lot we can do, but I think most importantly is it's really about recognizing that we have to also make the contributions to the international community to be a part of that. And I think that's something the world has always counted on Canada for, and I think it's fair to say that we want them to continue to count on Canada.
Yeah, I think that's really exciting. Honestly, seeing a future where poor nations have access to isotopes, that knowledge transfer. I think a lot of members or a lot of viewers that might be listening to this, they might not realize how important it is to have that knowledge transfer and that capacity building and development. What does that look like for a country to build out a supply chain for isotopes?
Well, I think the first thing is that firstly, it's the human resource capability. We often talk in nuclear about being we're in a technical business. I always disagree with that, because I think we're in a people business. What you have is you have an amazing capability cross-functionally of many disciplines of people. And it's those people that make your nuclear industry. They maintain the plant, they fix the plant, they design it, they develop innovations. And so I think we need to think about, as we're working with other countries around the world, that same dynamic. How do we develop their capacity in some of these treatments? A lot of these countries, for example, will not have procedures or practices or comfort with managing things like cobalt sources, something we're very used to in the world here for the past 73 years. So sharing that expertise is important, but it's also about recognizing that it's absolutely important for us to start somewhere. And that's what I really like about the IAEA initiative. They have a series of clinics that they've set up in different areas, and there's countries that have helped contribute to those clinic areas and done things that we would think are very basic. But you know what? If you look at the reports and you look at the testimonials, it's made a real difference in those communities. So we have knowledge transfer dating back 73 years ago. And I also think that, people have businesses, they have commercial interests, but isotopes is an area where we need to do what's right for Canada and for the world. And so we should be very open about sharing information. I know intellectual property is always something people like to arm wrestle about. Fundamentally, when it comes to treating cancer, and I know I'm talking in an ideal world, we don't want that to be a barrier for people. And I know that's more of an idealistic type view, but I really believe it to be true. So I think it's like opening arms. We do that in nuclear already, right? We share information, we share experience, we share what's worked, we share what hasn't. We have to do the same in isotopes. Because when it comes to fighting cancer, we shouldn't be keeping secrets.
Oh, 100%. I think that's super important. But when it comes to the cancer front, I'm always blown away by when I look up different isotopes that are produced in CANDU reactors or produced in facilities, like the vast variety of applications.
Absolutely.
Right? Like diagnostics, and then you have like treatments as well. Can you give us a little bit of a broad spectrum of some of these isotopes and their applications?
Yeah, so the first thing to think about is isotopes. The term we use in nuclear, and you're familiar with this, is the half-life. So I really think about as the half-life is how long is that isotope good for? So we have long-lived isotopes in the case of cobalt-60, and those are really good for applications that you want to have more permanently installed. So that's why sterilization makes sense. or applications where you're using something like the gamma knife for brain tumors, gamma pod for breast cancer, where you basically can have a constant source coming from that. So that makes sense for long-lived isotopes. However, the short-lived medical isotopes is what is the dominant driver around diagnostics and therapeutics. So we want the shortest-lived isotopes possible for diagnostics. Why? Because if I use an isotope as a diagnostic, I don't want it lasting in the human body for a long time. So we need short-lived medical isotopes for that. And if you look at the work BWXT Medical and Ontario Power Generation with molybdenum-99, that's a very, very short-lived medical isotope, right? They count it in hours, not weeks. And so that makes sense for diagnostics. So that's where you get the molybdenum-99. But then you have a series of isotopes that aren't quite as far out as cobalt, not for diagnostics. They're more like the therapeutics or theranostics. And those are isotopes that can have anywhere from, let's say, a week. And again, it provides more time for transportation. But a lot of these theranostic isotopes, what they are doing is they're not only treating the cancer, but they're finding it. So look at them on a decay spectrum. Long-lived medical isotopes we use for those more permanent installations. Very short-lived we use for diagnostics because they shouldn't last a long time. And then we have that sort of theranostics therapy piece. And it really ties to the decay timing. The good news with some of these isotopes that we're producing out in Ontario is they have a fast decay time. The bad news is they have a fast decay time. So I always like to look at it like you're taking an ice cube out of the freezer, you're putting it in your hand, and you have to get it in a patient's water cup halfway around the world. And so when you ask about supply chain, that's why that's so important.
Wow. No, honestly, I think you did an awesome job just going through that the half-life spectrum. What are the most popular isotopes in demand right now in the world for cancer therapy?
It's a good question. So I would say there's a number of heavy hitters. So on the long-lived isotope side, you have that high specific activity cobalt-60, primarily for the gamma knife for brain tumors. So that's very dominant there. Canada's a big supplier of that. On the diagnostic side, you see a lot on molybdenum. It's a diagnostic, so you see people doing work out of cyclotrons and reactors for those diagnostic isotopes. One of the fastest growing isotopes is lutetium-177. I call it a heat-seeking missile for those neuroendocrine tumors or prostate cancer. But there's also like the family of iodines, a lot of that coming out of McMaster. And so, all of these are growing at quite a similar rate. Typically, if you sort of looked at it on a percentage basis, heavily diagnostic, less therapeutic. Now you're seeing that sort of shift. Demand for diagnostics continues to go up, but these therapeutic heat-seeking missiles, as I like to call them, there's a huge growth in those.
Oh, wow, interesting. Why is there an increase in diagnostics, isotopes related to diagnostics?
So isotopes related to diagnostic is just because of the fact that you have a growing population across the world and more people having access to determine whether or not they have cancer. And so you need those diagnostic isotopes. In terms of the growth on the theranostic isotopes, have a component of diagnostic and therapy, theranostics. The reason why those are so popular is because in certain cases of people who are battling or struggling with cancer, is these theranostic isotopes have the ability to find, for example, a neuroendocrine tumor, find that and treat that while leaving the healthy cells untouched. One of the things we know about cancer treatments and treatments like chemotherapy, which are so important and will continue to be important, is oftentimes one of the real challenges a patient has is the impact to not just fighting the cancer, but what it does to the non-cancerous cells. And that can be, clearly very challenging. So these theranostic isotopes are where it's appropriate to use them is to some degree minimizing that risk. What I will say though is, and it's because it's very important to be balanced, is that even though isotopes are growing significantly in use, amazing treatments like chemotherapy are still going to be very, very dominant and important, right? So I look at this as how are we continuing to add more tools in the toolbox for our frontline healthcare professionals? And that's really what it's all about. It's not about one competing with the other. It's about when that patient is faced with that most difficult time in their life, how does their frontline professional, doctor, nurse, have access to the best tools for that patient? That's what it's all about.
Absolutely. I think that's a great message to end off with. James, this was a really a great conversation, very enlightening. I think a lot of the viewers on this channel will find a lot of value in learning about isotopes, because it's a topic that I actually hasn't been discussed as much on this podcast.
Awesome.
But is there any last message that you'd like to leave with the audience?
No, the only thing I would say is real kudos to you. Firstly, I love your podcast. I watch it. I told you when we were getting ready that I use the videos. I really think what I like about this podcast, and I hope this isotope discussion will help, is we need to simplify these messages down so people understand them. What we can't have is a scenario is whether it's a nuclear power, whether it's an isotope, some of these other challenging areas, we have to be able to communicate simply. Because if we don't, we sometimes are robbing ourselves of the opportunity to make a compelling argument why something needs to be done. And I love your podcast. And also the people that watch it, how they spread the message is really, really important, because this is a Canadian success story and we need to be talking about it more, and there's a lot to make happen. So, but thank you for having me.
It's my pleasure. And thank you so much. I really look up to you as a leader in our industry, and that really means a lot, those kind words. So for those that are watching, in the description below, you can find more information about the Canadian Nuclear Isotope Council. You can also find the link to a podcast by the CNIC, and as well as James' contact if you're interested in reaching out to him. So thanks again for tuning in. Until next time.